Picamillon is known for having strong anti-anxiety effects while boosting concentration, focus, memory and motivation, and also lowering blood pressure. Picamillon is a combination of the inhibitory neurotransmitter GABA with nicotinic acid, a form of B3 or niacin. The addition of niacin allows the GABA to cross the blood-brain barrier. Neurohackers prefer either Picamillon or phenibut when the goal is to raise the GABA levels in the brain. This is because GABA alone can't cross the blood-brain barrier. And note, taking GABA and niacin as a stack will not produce the same effects as Picamillon. The GABA is bonded with the niacin to produce Picamillon, and its molecule is what does the magic in the brain. Picamillon was developed in Russia in 1969 by the All-Union Research Institute. It's been used since 1986 as a pharmaceutical in Russia to treat attention, memory and learning problems, and for the treatment of loss of blood circulation to the brain trauma, chronic alcoholism and other disorders. The company's promotional material states, "The important property of Picamillon is the ability to quickly restore mental and physical fitness for work, which was lost through overstress." Once Picamillon crosses the blood-brain barrier, it hydrolyzes into GABA and niacin. The GABA activates the GABA receptor, producing an anxiolytic response, and the niacin acts as a vasodilator, relaxing constricted blood vessels and improving the blood flow in the brain. Picamillon has an inhibitory effect on overly stimulated neurons because it raises GABA levels in your brain. Low GABA levels lead to anxiety, depression, and insomnia. GABA helps to restore that balance, promoting a more positive mood, which improves focus and relaxation. Picamillon is unique among GABA boosters because it boosts cerebral circulation also. It increases cerebrovascular activity better than paracetam and vinpocetine. The nicotinic acid, the niacin, in Picamillon boosts the blood flow, enhances cell metabolism and oxygen supply in the brain, resulting in an improvement in short-term and long-term memory. Picamillon has been used to normalize serotonin and dopamine content and dopamine uptake in the brain. Dopamine aids in memory formation, attention, focus, and cognition. GABA's role is to keep glutamate, the primary excitatory neurotransmitter, from overwhelming your brain. Too much glutamate can cause a seizure, and too little GABA can put you into a coma. A healthy brain maintains a critical balance of GABA and glutamate. GABA acts like a brain on the neuron circuits during stress. Low GABA levels can result in anxiety, insomnia, poor mood, and restlessness. Clinical studies show that boosting GABA with supplements like Picamillon relieves anxiety, stress, and boosts the production of alpha brainwaves. If GABA is optimized in your brain, you'll feel focused, relaxed, and stress-free. The big challenge for cognitive health is trying to boost GABA in the brain. GABA can't cross the blood-brain barrier on its own. It needs help to carry it across. This is where the B3 niacin in the Picamillon formula helps the GABA to cross the blood-brain barrier, and the reason why some neurohackers prefer Picamillon when the goal is to raise GABA levels in the brain. Picamillon is unique among GABA boosters because it can boost cerebral circulation also. It increases the cerebrovascular activity better than paracetam and vinpocetine. When using Picamillon to boost GABA, you enhance cerebral circulation, you lower blood pressure, and you even stimulate the pituitary gland to secrete human growth hormone, which is anti-aging. It also helps produce endorphins that make you feel good after a workout or after sex. As a nootropic, when you use Picamillon to normalize GABA levels, you'll improve blood flow to the brain. You'll experience a reduction in anxiety, insomnia, nervousness, restlessness, and stress. Picamillon exhibits the properties of a tranquilizer, but with a stimulating component. But unlike tranquilizers, Picamillon does not include muscle relaxation, drowsiness, or lethargy. Once in the brain, the Picamillon separates back into niacin and GABA. The GABA works by preventing neural signaling that's associated with anxiety from reaching other neurons. It does this by attaching to the receptors that would otherwise excite those neurons. Overstimulating neurons in certain areas of your brain is what causes anxiety-related symptoms. Studies have shown this unique combination of niacin and GABA affect the regulation of neurotransmitters in the brain. Picamillon was shown in one study on Parkinson's disease to normalize serotonin and dopamine content and dopamine uptake in the brain. Picamillon is more effective than paracetam and vinpocetine in improving blood flow to the cerebral vessels in the brain. It easily crosses the blood-brain barrier to protect neurons against the effects of diminished oxygen flow. Picamillon separates into niacin and GABA once it crosses the blood-brain barrier. Niacin acts as a vasodilator, relaxing blood vessels and allowing the free flow of blood in the brain. Picamillon is often prescribed in Russia for the treatment of migraine headache. A study published in Nutrition Journal reviewed clinical trials from 1990 to 2004, looking at studies using niacin to treat migraines and other tension headaches. The conclusion from the study showed that niacin had effectiveness for its vasodilatory properties in increasing the cerebral blood flow and its ability to improve mitochondrial energy metabolism. The result is fewer migraines and less headaches when using a nootropic that contains niacin. Low levels of GABA and poor cerebral circulation are associated with a variety of health problems like anxiety, panic attacks, stress, and insomnia, muscle spasms, hypertension, convulsions, Tourette syndrome, and epilepsy. Neurotransmitters decline. ATP energy levels decline, starving the mitochondria in your brain cells. When your neurotransmitters, including GABA, are in balance, you feel motivated, productive, and energetic. You feel calm and relaxed during your downtime. When GABA levels are low, you feel filled with dread. You're constantly worried. You have racing thoughts, and you're frequently late and disorganized. Many people in this GABA slump resort to a high carbohydrate food or drugs and alcohol to relax. We need adequate GABA levels in our brains because it's an inhibitory neurotransmitter. When we raise GABA levels by supplementing with picamillon, we help to keep glutamate in check. Glutamate is your body's most abundant excitatory neurotransmitter. It's responsible for attention span, brain energy, learning ability, memory, and staying awake. So GABA is calming and glutamate is stimulating, and they must be in balance with each other for optimal cognitive health. An imbalance of these two neurotransmitters can cause fibromyalgia, chronic fatigue syndrome, poor memory and cognition, anxiety, and depression. When these two neurotransmitters work together efficiently, you feel relaxed with no stress or feelings of anxiety. The addition of nicotinic acid in the picamillon formula helps to improve cognition even more. One study with 96 healthy volunteers was done to determine the effects on memory with the nicotinic acid. The study found that nicotinic acid, or the niacin, enhanced the cell metabolism and the oxygen supply in the brain, resulting in an improvement in short-term and long-term memory. Adding picamillon to your nootropic stack can help to bring the GABA and the glutamate back into balance. When you balance the GABA levels in your brain, you feel relaxed and calm. Many neurohackers who try using GABA as a supplement don't feel the effects. This is because the GABA molecule is too large to cross the blood-brain barrier. If you do feel the calming effect from supplementing with pure GABA within half an hour of taking it, some say that means that you have a leaky blood-brain barrier. This means if the GABA can get through it, all kinds of nasty stuff can also get through, including toxins, undigested food particles, and anything else in your bloodstream that shouldn't be there in the first place. However, there are GABA receptors in the gut also, so it's debated that the calming effect from pure GABA is reducing the feeling of butterflies in the stomach, and this is what's calming the patient. You can increase the GABA levels with picamillon as it can cross the blood-brain barrier. Neurohackers report that adding Picamillon to their stack relieves anxiety better than Xanax. There's less stress and they feel more relaxed. Picamillon also offers a stimulant effect, providing mental clarity. Dreams can become vivid, and it's not sedating like phenibut. Phenibut is also considered very addictive by some, and it comes with withdrawals and a quick tolerance build-up. Social function can get some help from Picamillon. You could feel less inhibited, speak freely, and feel more confident. Picamillon generates a calm focus without making you drowsy. Some neurohackers maintain that the magic with Picamillon is the nicotinic acid. It's what provides the stimulant effect and gives you an energized type of calmness. The cognitive benefits of niacin are also considerably underrated in the nootropics community. Picamillon is extensively studied in animals and humans, and has been shown to act like a tranquilizer without the sedative effects of muscle relaxation, drowsiness, or lethargy. The studies show that Picamillon decreases anxiety, fear, irritability, and symptoms of emotional stress. It inhibits aggression and it restores physical working capacity after stressful work. Picamillon has been proven to prevent forgetfulness, enhance memory, improve recall, and improve mood. It decreases headaches, dizziness, and tinnitus. It increases mental and motor activity in patients with anxiety and depression. Picamillon has been shown to prevent or to suppress diabetic neuropathy and alleviate the effects of alcohol withdrawal. It helps glaucoma, retinal and optic nerve damage, and it helps those with neurologically based urinary problems. Reports by neurohackers repeatedly show that Picamillon provides a calm focus without making you drowsy. A study was done with Parkinson's patients. It's well known that serotonin and dopamine content and dopamine uptake by neurons in Parkinson's disease is decreased. The research found that Picamillon normalized the dopamine uptake in Parkinsonism, and that Picamillon is involved in the regulation of brain neurotransmission under experimental Parkinsonism, and this can be useful in the treatment of Parkinson's disease. NADH boosts ATP energy production within the brain's mitochondria, and this energizing effect is often spoken of when using Picamillon, and it comes, at least in part, from the niacin component. A study done on a 1-month-old rat looked at trauma of the brain. The researchers studied the oxidative damage done on the brain mitochondria 1, 4, and 7 days and 4 weeks after the trauma. The young rats were given several different nootropics to see the effect on the rat's mitochondria, and they concluded that Picamillon had a protective effect on the function of the brain's mitochondria during the trauma. Picamillon increases blood supply, oxygen saturation, and blood circulation in the brain. This boost in blood flow brings the nutrients and oxygen needed to fuel the adenosine triphosphate that power the brain cells' mitochondria. The recommended daily starting dose of Picamillon for anxiety is 50 milligrams 2 or 3 times per day. If you're looking for a stimulatory effect, you could safely increase your dose to 100 milligrams 2 or 3 times per day. Picamillon is considered safe when taken in normal recommended doses. Picamillon has not been shown in clinical trials to produce any allergic or toxic effects. The only side effects noted were headache, dizziness, and nausea, and nearly always when taken above the recommended dose. At higher doses, Picamillon can lower your blood pressure, so if you're already on blood-lowering medication or you have an issue with blood pressure, you should not use Picamillon. It's also recommended to take a 1-month break after 3 months of Picamillon use. Your body does make GABA on its own from glutamate in the brain. Most people have an adequate supply of GABA, but if you're dealing with anxiety or stress and you need some extra help in calming things down, Picamillon can help. Picamillon is particularly helpful if you're dealing with anxiety. Some neurohackers report that Picamillon is as effective in dealing with anxiety as many prescription anti-anxiety medications. Picamillon exhibits the properties of a tranquilizer with a stimulating component, but unlike tranquilizer drugs, Picamillon does not induce muscle relaxation, drowsiness, or lethargy. In addition to its calming effects, Picamillon may help to improve your memory, your recall, and your concentration. There's no reported added benefit to doses higher than those recommended. In fact, the reverse appears to be true. Lower doses have more of a calming and cognitive benefit for most people.